Let's see. Which of the following is the most appropriate initial management for this patient's amphetamine withdrawal symptoms? A 22-year-old woman presents to her primary care physician with complaints of fatigue, depression, and excessive sleepiness. She reports having used amphetamines regularly for the past 2 years, but has recently decided to quit. She has been experiencing these symptoms since discontinuing amphetamine use. I probably wouldn't give them antipsychotics
Okay.
or methadone. Benzos, from what I remember at least, you definitely give it to patients with alcohol withdrawal, but I'm not sure if that also applies to amphetamines. But I've always seen like benzos usually used as that type of medication. Um, Buprenorphine, I don't remember the mechanism for that. Methadone, I would associate more with like an opioid situation. So,
What's your gut answer choice here?
uh, I'd probably just pick benzos, but yeah,
Okay,
not
final answer.
yeah.
Actually, supportive care. So let's talk about this a little bit on a clinical standpoint, right? Amphetamines, are they upper or downer?
Up.
Yeah, upper, right? They're stimulants, right? So when you're on amphetamines, it's like just imagine you took 1 gram of caffeine, probably, right? Probably you're bouncing off the walls, right? So now you stop it. If you stop amphetamines, what symptoms do you get?
So you would have the fatigue, depression,
Yeah,
excess.
the
Yeah.
reverse, right? I always think if you take an upper and you stop, you get the reverse. If you take a downer and you stop, you get the reverse. You understand what I'm saying? So if you're an opioid and if you're addicted to opioids, then when you take opioids, you're gonna be really sleepy, right? Really sluggish, right? Because and it relaxes you, right? Opioids, right? They're downers. And if you stop that, then the reverse is gonna happen, right? You're gonna get overly excited, etc., right? So in this instance, when we're talking about amphetamines, she stopped amphetamines and she's getting. Would you say this is expected when you stop amphetamines?
Um, I I guess I think
Yeah,
the with
yeah.
benzos, I think it would make it worse.
100%. Exactly, right? Because benzos, they act like what? They act like alcohol, right?
Mhm.
Because they work on GABA receptors. So they actually relax you. They kind of sedate you, and benzos are a downer. So you want to put a downer on somebody else who is already down, right? That's going to be worse, right? And then methadone is usually for opioid, right? Antipsychotics, right? She's not psychotic, right? And I can't remember buprenorphine. Let's see what this is. Partial opioid agonist for management of opioid withdrawal. So that's opioid. But amphetamines, right? You just give them supportive care, right? Because eventually, over time, this is gonna, this is just part of withdrawal. You know what I mean?
Mhm.
So, okay, questions, concerns?
No.
Okay, perfect. So just remember in your mind when you classify drugs, kind of like recreational drugs, you want to put them in uppers or downers so that you understand, like you can generalize what their side effects are.
Right. Okay.